Hi, I'm Yasmin. I'm a maternity dietitian. So today we'll be talking about how to manage your gestational diabetes through the diet. So hopefully you've attended our group session where the midwife will explain to you the risks of gestational diabetes and how we'll be treating you throughout your pregnancy from now on. So today I'll be going through how we treat your gestational diabetes through diet and exercise. So we'll be covering a lot of ground, but in your yellow notes you will find a couple of sheets that we've put inside that help explain everything about the diet as well. I also work alongside the diabetes midwife, so if throughout your pregnancy, at any of your appointments, if you do feel the need to speak to me, again, my name is Yasmin, so you can always ask to speak to me. So today we'll be covering, as I mentioned, a lot of ground. We'll be talking about the foods that affect your sugar levels. We'll talk about portion sizes of these foods. We'll talk about fruits, because they will affect your blood sugar levels, but they're really healthy, so we'll discuss how to keep them in the diet. We'll discuss hydration, physical activity, and smart shopping as well. So the first thing that we need to talk about with regards to your diet is your meal pattern. So it's very important that through your pregnancy, you firstly do not cut out carbs. So although carbs will affect your sugar levels, they're a really good food group to keep in your diet, because not only do your brain and your muscles rely on carbohydrates to keep functioning, but your baby. In order for baby to grow, baby does need these sugars. So when I talk about carbohydrates, we talk about things like bread, potatoes, pasta, rice, cereals, also known as all the tasty foods. They will affect your sugar levels, but they're really healthy. So through your pregnancy, we would like you to continue having carbohydrates with your breakfast, your lunch, and your dinner. Then in between these main meals, as your snacks, we want you to have your fruits. So ideally keep your starchy carbs separate from your fruits, just because if you have your starchy carbs with your fruits, it might be too much sugar for your body to process in one go. So funnily enough, through your pregnancy, lots of women struggle with actually eating enough. We want you to eat very frequently in your pregnancy. So we want you to have a breakfast, snack, lunch, snack, and if you're hungry, a before bed snack. So as I mentioned, keep your starchy carbs separate from your fruits. With your evening meal, we don't want you having it too late at night. We say roughly 7:30, 8 o'clock latest, just because if you eat too late at night, it can affect your morning sugars the next day. Because if you eat late at night, you're not really using the sugars in your bloodstream, they're kind of just sitting there. So the next morning, when you test your sugar, it will still be sitting there. So try to have your dinner earlier if possible. If this means that you're bringing your dinner forward and you're feeling hungry before bed, you can have a high protein snack. So this will be something like some boiled egg, maybe some cheese, a small pot of yogurt, handful of nuts. These are really good snacks to have before bed because they'll keep you full for long and they won't affect your sugars as much. So with regards to your meal pattern, we want you to be eating frequently. We want you to have your starchy carbs and your fruits, but ideally keep them separate. Try not to leave a long gap between your meals. So I know everyone's routine is different, but try to eat as regularly as you can, just because if you go a long gap without eating any carbs, your body will release its emergency sugar. With your emergency sugar, it's harder for your body to manage this because it will likely result in a sugar spike and crash. But your body manages the sugar from your diet much more easily. So try to eat regularly if you can. Now we'll move on to the types of carbohydrates. So as I mentioned, carbohydrates include things like potatoes, rice, pasta, cereals. We will also get sugar from our diet in our naturally occurring sugars. So these will be things like fruits, which contain fructose, and also dairy, which contain lactose. So with your starchy carbs, the type of carbohydrate you choose is very important. And the way I like to explain it is if you were to give a child very sugary sweets, think about what happens to them. They get all this energy, they're bouncing off the walls, they're experiencing what we call a sugar spike. So if you imagine it on a graph, their sugars are spiking really high really quickly, and then what goes up must come down. So they often result in a sugar crash. So their sugars are dropping, they might throw tantrums, they might feel tired, they might cry. The same thing happens as if you or I have the wrong type of carbohydrate or too much of a carb, then we won't throw a tantrum, we're not going to cry, but you might notice you feel a bit sluggish after your meal. You feel a bit tired, maybe find it hard to focus on whatever it is you're doing at the time. This is what we call the sugar crash. So as I mentioned at the beginning, your baby needs these sugars to grow. So if your body detects that your sugars are dropping, it goes into a bit of a panic and thinks we need sugars now because we need to grow the baby. So your body might seek out quick sugar foods. These often show up as cravings. So these might show up as cravings for things like cakes, biscuits, sweets, pastries, what we call normally the naughty food. These foods will result in a sugar spike and crash, and it's much harder to manage. So ideally through your diet, we should be looking at the right type of carbohydrate. So foods that will give you a more slow release of glucose, so a slow release in sugar and a slow reduction in sugar, are things like wholemeal breads, whole wheat pasta, seeded bread, sourdough breads are okay as well, brown rice for example. Generally carbohydrates that are a bit more brown in colour have a bit more fibre to them. What this fibre does is it acts like a wall to the sugar, so it kind of traps that sugar. So when you eat these carbohydrates that are a bit more fibrous, the sugar isn't absorbed as quickly versus if you have a more processed carb, things like white bread, white rice, white pasta, sugary cereals for example. So ideally with your meals, try to focus on more fibrous carbohydrates. Generally if it has more whole in the name, it'll be better for you. Just as important as the type of carb you choose to eat is what you choose to eat with it. This is what we call food pairing. So with all your carbs, try to have some sort of healthy protein and healthy fat. As an example, if you were to have toast for breakfast, instead of having that toast with something like jam or Nutella or honey, which are very sugary, instead, if you pair it with a healthy fat, for example avocado, maybe a healthy protein, for example a poached, scrambled or boiled egg, the healthy fat and healthy protein trap that sugar, just like the fibre do. So even though both situations you've got the same carbohydrate, you've managed to very rapidly change how quickly that sugar is absorbed, just by changing what you eat with it. So the instance with the toast, the jam, the Nutella, the honey, that will spike and crash your blood sugars, but that same bread with avocado, with egg, you won't get quite the sugar spike. Other examples of food pairing, if you were to have some fruit, you could pair this with some natural Greek yogurt. On top of that, you could have some nuts and some seeds, which is really good healthy fat, and that way you help manage your sugars better. Another example, if for a snack you wanted a rice cake or an oat cake, you could pair that with some avocado, with some hummus, boiled eggs, some cheese or tuna, and that helps absorb it much more slowly. Just as important as the type of carb and what you choose to eat with it is the portion size of carbohydrate. So I'm going to show you a portion plate now, and it will show you the sizing of foods on your plate. So you can see here, you've got a quarter of your plate being your carbohydrates, a quarter of your plate being your protein, and half your plate being your vegetables. With your carbs, I know there's a picture of bread, but I normally say for pregnancy, the exception is if you are having bread, you're allowed 2 slices. So 2 slices of bread is a portion. Just make sure it's a medium or thin slice, so no thick slices breads. Otherwise, potatoes, rice, pasta, these should all be roughly a quarter of your meal. Be careful of what we call double carbing. So for example, very popular meals, things like pizza and garlic bread. Pizza base is made from bread, then you've got garlic bread, you've got 2 types of carbs. Burger and chips, the burger bun is made from bread, then you've got chips, you've got 2 types of carbs. Triple carbing even, if you have a curry that's got potato, then you've got some rice, maybe some naan bread, you've got 3 types of carbs there. Even more sneaky than that, anything with a batter or breadcrumb coating will also contribute to your carb intake. So batter coatings, things like battered fish, maybe chicken nuggets. The batter coating is made with flour, which is a carb, or breadcrumb coating, for example, breadcrumb fish fingers, or breaded chicken, for example. The breadcrumbs are made from bread, which is another carb. It doesn't mean you can't have these foods, you definitely still can have these foods, just have less of the other carb. The reason why is it catches a lot of women out sometimes. Sometimes they feel like they're sticking to a quarter of their plate being carbohydrates, but then there might be something else on the plate that's contributing to their sugar levels that they're not quite aware of. So it's really important that you stay aware of all the carb sources on your plate. Next, your proteins. These foods will keep you full for the longest time. So if you're vegetarian, these will be things like soya, tofu, beans, chickpeas, lentils, and if you do eat meat, it will be things like chicken, fish, eggs, for example. These foods keep you full for long, so make sure you have plenty of these and they won't affect your sugar levels as much as carbohydrates do. Then your vegetables, it doesn't have to be a plain salad if you don't want it to be. You could have it roasted, stir-fried, steamed, you could have it in a soup, stew, curry, however you want to have your vegetables, as long as it's the majority of your meal, because these foods will give you fibre. And remember I said that fibre traps that sugar, so it's really important you maintain having your vegetables. So With your fruits, you're allowed up to 3 portions of fruit a day. Over the course of the day, we want you to have 5 portions of fruits and vegetables, but just to help manage your sugar levels, we want no more than 3 of those portions to be your fruits. So a portion of fruit is whatever fits in your hand. So 1 apple, maybe 2 tangerines, handful of berries, handful of grapes, a small banana. And the trick with your fruits is when they first come to you, they're probably not that quick release sugar. So they won't give you that much of a sugar spike. But as they get riper, as they get sweeter, they're more quickly, the sugar in there is more quickly absorbed. So for example, if you're having a banana, try to have it as green as you can. The greener the better. I know it doesn't taste as nice because that sugar hasn't been released yet. So try to have it as least ripe as you can, just because that sugar won't be as quickly absorbed. With your fruits as well, try to focus on fruits with the skin on. So the skins are a really good source of healthy fiber. And remember again, that fiber traps that sugar. So things like apples, pears, peaches, plums, these foods will be the best fruits that you could eat during a pregnancy. For this reason as well, we say to avoid juices and avoid smoothies. Just because once you juice a fruit or you blend a fruit, it gets rid of that skin, which means it gets rid of that fiber. So that sugar is very, very quickly absorbed. And the way I like to explain it is if you were to juice 1 orange, you probably only get about that much juice. So if you think a glass of orange juice is probably 4, 5, maybe 6 oranges worth of sugar even. But how many of you could eat 4 or 5 oranges, really big oranges in one go, in the same time it takes you to drink a juice? Probably not many of you, because when you're eating the fruit whole, you get that fiber, and that fiber signals to your brain. It says you've had enough sugar, time to stop, and it keeps you full. When you drink a glass of juice, you don't get that signal to the brain. So it's very easy to take lots of sugar in one go without feeling full. If you have been recommended iron tablets by your doctor, quite often they'll say to take the iron tablets with orange juice. And the reason why is because vitamin C helps to absorb iron. So instead of having that juice, you could instead eat the orange whole, you could have some tangerine. Other good sources of vitamin C are things like bell peppers or tomatoes. So if you're having a meal containing these foods, they're also really good, or kiwi fruit. Kiwi fruit is also a really good source of vitamin C as well. So you can eat your vitamin C instead of drinking it. With your fruits as well, try to minimize or avoid dried fruit as much as possible. So dried fruit, because the hydration has been taken out of there, they will be very concentrated sources of sugar. So try to limit dried fruit if you can. Exotic fruits, things like mangoes, pineapples, papaya, melons, these will tend to be a bit more sugary with less fiber value. So try to limit these if you can as well. And remember, with your fruit, always try to pair it. So have maybe some plain yogurt with it, or some nuts with it, some seeds with it. Peanut butter as well is a really good thing to have with your fruits, just to help slow down how quickly the sugar from that fruit is absorbed. Through your pregnancy, staying hydrated is also very, very important, especially during these hot summer days that we're getting. So staying hydrated will help manage your blood sugar levels, but also keep up with your body's demands. During pregnancy, you're creating a lot more blood volume and also more fluids in your body, things like amniotic fluid. So you need to drink enough to keep up with the bodily demands. So during pregnancy, we recommend about 1.5 litres to 2.5 litres a day. This is roughly about 7 or 8 glasses. And remember, you can always flavour your water as well. So you could always add things like a squeeze of lime, a squeeze of lemon, maybe some mint or cucumber or sugar-free squash. With sugar-free squash, you can always freeze it, so you can make some ice lollies or some slushies, and this helps cool you down, but also keeps you hydrated as well without affecting your sugar levels. Tea and coffee will also contribute to your hydration. Just be mindful of caffeine in your pregnancy. So through pregnancy, we say roughly 200 milligrams of caffeine a day, which looks like 2.5 mugs of tea or 2 mugs of instant coffee, or if it's a shop coffee, a medium size will be your max in the day. So if you wanted more than that, you can always have decaf. So decaf tea, decaf coffee is absolutely fine to have. If you sweeten your teas or coffees, just be mindful that white sugar, brown sugar, honey, jaggery, these will all have the same effect on your blood sugar levels. Lots of people have opinions about one being better than the other because one may be more natural, but when it comes to testing your sugar levels, these will all show up the same. So through your pregnancy, you can have artificial sweeteners. They are safe to use in pregnancy, things like stevia, truvia, sucralose, sweetex, for example. However, I do understand that if you do feel cautious using sweeteners, you don't have to. So the choice is completely yours. You can sweeten using sweeteners, or you can wean down how much sugar you're having. Both will help manage your sugar levels. A very popular question I get is about which milk to use. So through pregnancy, every woman is different. We do get women that are fine with whole milk, with semi-skim milk. Majority of women that we do see have the best sugar readings with the semi-skim milk. However, what I normally recommend is, because you've just been taught how to test your blood sugars, continue having whichever milk you're currently having and see how your sugars are. If you find that it's going high after you're having your milk, then you can switch to the green top. If you have alternatives, try to avoid rice or oat milk, because these will be derived from carbohydrates. Go for nut-based milks, things like cashew, almond, hazelnut milks, for example. Soya milk is also good. Just make sure they're unsweetened and they have added calcium in there. Fizzy drinks, try to avoid fizzy drinks if you can, but we also appreciate that life happens, occasions happen. There might be a birthday or a celebration, and you don't want to be the only one drinking water. So you can have diet or zero sugar versions. Again, just be mindful of caffeine. A lot of people forget that these fizzy drinks do still have a little bit of caffeine in them. So don't drink them by the gallons, but 1 or 2 glasses is fine. On the shelves, you can see decaffeinated sugar-free fizzy drinks as well. So those would be the best options if you are craving a fizzy drink. So it's very important through your pregnancy that you stay active. I know it's probably the last thing you want to do right now, but trust me, it's really good for both managing your blood sugar levels, but also for your health. Not only your physical health, but also your mental health as well. So through pregnancy, we recommend about 150 minutes a week per day. This is only about 20 minutes. And it doesn't mean that we expect you to sign up to the gym and lift really heavy weights, nothing like that. Literally walking. Walking is probably the best exercise you can do. So there are different ways you can do your activity. You can walk, you can swim, you can do stretching. If you don't feel like going outside for a walk, you could always go on YouTube, look at pregnancy exercise videos, things like yoga, Pilates, stretching, dance, anything you enjoy. If you've got little ones, they probably keep you more active than you realise through the day as well. So any activity you can do is really good, and whatever you find manageable and enjoyable. The best way to do your exercise to help manage your blood sugars are after your main meal, so after your breakfast, your lunch, your dinner. Give yourself about 15-20 minutes, let it digest, then go for a walk. When you test your sugars an hour after that meal, you'll find that it will be lower than if you didn't do any activity. Because when you move your muscles, it uses the sugars in your bloodstream to help fuel it, and this helps bring your levels down. So it's really, really important that you keep active during your pregnancy, but listen to your body and adapt as well. So if in the later stages of pregnancy, as your bump gets bigger, if you do experience any pelvic pain, tailbone pain, shortness of breath, listen to your body and take it easy. Don't push yourself too much. Through your pregnancy, any exercise you could do, you should be able to hold a conversation. So you shouldn't feel so out of breath that you can't hold a conversation. That might be that you're pushing yourself too much. So you should be able to talk while you're doing your activity. When you go to the shops, have a look at the labels on the packaging, but don't turn it around, because the back of packaging is very confusing. You've got 1,000,001 numbers, you've got carbohydrates, you've got sugars. It's really hard to know what to look for. Instead, on the front of packaging, you'll see some traffic light colours. So they're normally on the bottom left, and you'll see red, green, yellow. If you think of it like a traffic light, if it's green, you can go for it. If it's red, stop, put it back. If it's yellow, proceed with a little bit of caution. You can have a small amount. So the best things to look for in terms of managing your sugar levels are, of course, sugar, but also in pregnancy, we want you to be keeping an eye on salt. Salt will affect your blood pressure. So, for example, if you were to go shopping and you were buying a sandwich, if you see that one sandwich has more green and more yellow versus another which has more red and yellow, you would choose the one that's got more green. So again, think of it like a traffic light. The reason why I say to look at the traffic light colours as well is because other labelling can be quite confusing. For example, the label that says no added sugar. No added sugar doesn't mean that it's sugar-free. It's very confusing, I know. So no added sugar just means that the manufacturer hasn't added extra sugar on top. So for example, you'll see this label a lot with things like juices and smoothies, but as we've already discussed, these will have natural sugars in them. So when it comes to the colours, for sugar, juices and smoothies will probably be yellow or red, which indicates that it's quite high. However, you'll also see no added sugar on things like sugar-free squash, which would be green for sugar. So again, this label is very confusing. Be very careful of what we call diabetic products. So on the shelves, you'll see things like zero sugar biscuits, zero sugar chocolate, for example, things that normally aren't sugar-free. The sweetener that they use in these products is not a normal tabletop sweetener. They use what we call an sugar alcohol. So these will be things like sorbitol, maltitol, xylitol, for example. These sweeteners, if consumed in large amounts, which is very easy, once women are sugar-free, it's very easy to go through a whole box of sugar-free biscuits. If you have lots of them, they will make you go to the toilet, and we don't want you spending the rest of your pregnancy on the loo. So try to avoid diabetic products if you can. If you do get cravings, which are very normal during pregnancy, I want you to think of the 2 P's, so portion control and pairing. So for example, if you are craving a biscuit, have 1 biscuit, but pair it. Maybe have some peanut butter on top, or you can crumble it, put it on top of some yogurt. If you're craving chocolate, which is probably my most popular question to date, have it as dark as you can. So the darker the percentage, the less sugar. Have a small amount, so limit yourself to 1 square, and pair it. Have some nuts with it, have some seeds with it, or have some yogurt with it, just on the side. So then you get the taste of what you like, but you keep yourself full, so it stops you going for a second portion. With chocolate as well, you can always freeze it. It sounds very weird, I know, but if you freeze your chocolate, it melts a lot slower. So for example, 1 square of frozen chocolate will melt just as long as maybe 2 or 3 squares of unfrozen chocolate. So that way it feels like it lasts a lot longer, but you get less sugar with it as well. When you go to the shops, be careful of hidden sugars. So these will often be in things like sauces, things like ketchup, sweet chili, barbecue sauces, baked beans in a tomato sauce. So go for reduced sugar and reduced salt varieties ideally as well. Remember as well, through your pregnancy, every woman is different. So if I sat you all in a room and gave you all a slice of bread made from the exact same loaf, exact same ingredients, in 1 hour's time, every one of you will have a different number on your meter. The reason why is because you've all got different varying levels of hormones by your placenta. So you're not all going to react to food in the same way. So it's very, very important through your pregnancy, you don't compare yourself to anyone else. Even the same woman who's had gestational diabetes in previous pregnancies, she finds it presents differently each time. So something that may have worked before may not work now, and something that didn't work then, she might be okay with now. So even in the same woman, it's different. So use your own blood sugars as your guide to what's working for you, what's not working for you. We'll be seeing you more frequently at your appointments as well. And as I mentioned, I'm always with the diabetes midwives. So if you do feel like you need a one-to-one or you do have any questions, you can always ask to speak to me. My name is Yasmin. Thank you for listening.